Hello and welcome to our podcast series. My name is Meghann Drella and I am a Senior Solutions Manager here at Outsource Strategies International. Today I will be discussing the CDT codes to report dental restorations and restorative dentistry. Dental restorations or restorative dentistry refers to dental procedures that repair or replace a tooth. The tooth structures can be missing due to decay, deterioration, or fracture of a tooth. Dental restorations can fix those problems. Restorative procedures include fillings, crowns, implants, bridges, dentures, and root canals. These procedures are done for diverse purposes, such as to restore the function of the teeth, improve the appearance of the teeth, prevent further dental issues, eliminate the pain caused by infections, or preserve the bone density. A full list of codes associated with each of these procedures will be attached to this podcast. To get the CDT codes assigned right, though, it's really important for the practice's billing and coding team to be up to date with the coding changes and guidelines. It is also extremely important to make sure a full, comprehensive dental eligibility verification check is done prior to the patient's procedure to verify what is covered and what is not covered. I hope this helps, but always remember that documentation, as well as a thorough knowledge of payer regulations and guidelines, is critical to ensure accurate reimbursement for the procedures performed. Thanks for joining me, and stay tuned for my next podcast.